of the day.
Ballot item number 58, private member's notice of motion number 145. Ms. Stiles.
Davenport to move her motion.
Thank you, Mr. Speaker. I move that, in the opinion of this House, the Ford government should establish a Child and Youth Post-Pandemic Recovery Secretariat to develop and implement a youth recovery action plan to help mitigate the pandemic's impacts on children, youth, and young adults, particularly those disproportionately impacted by COVID-19.
Ms. Stiles has moved the private member's notice of motion number 145. Pursuant to Standing Order 101, the member has 12 minutes for her presentation. I return to the member from Davenport.
Thank you, Mr. Speaker. It's an honour, as always, to rise in this House and speak on behalf of the great people of Davenport. In this place, we have, for the last year, been grappling with some of the most important questions of this moment of maybe a generation. How do we keep our communities safe? How do we truly value and recognize the work of those on the front lines of this pandemic? How do we protect our most vulnerable, our elders, our children, those most impacted? How do we prevent the equity gap from growing against all odds? Today, I fear we are still very much in the eye of the storm. I hope I'm wrong, but certainly the challenges before us are massive. Speaker, the greatest test of any government in the midst of a disaster of this proportion is to keep a clear focus, certainly, on limiting the impact, preventing the loss of life and of illness, prevention. But here's the rub. They have to do that while they're also mobilizing the resources and the expertise to plan forward for recovery. And that's why I'm here today, to raise the urgent need for us to centre children, youth and young adults in Ontario's pandemic recovery plans, and to provide a path forward for us to get that done. Over the last few months, I've been speaking with experts in education and child and youth development and more, who have been particularly concerned about what this disruption to learning kids experienced this year is going to mean down the line. I've also been speaking with many, many young people. It's really the perk of being the official opposition education critic, I have to say. It's one of my favorite things to do. From follow-up calls with individual young people who reach out to me with questions or ideas, to clubs like the Milton District High School Student Equity Group that I met with just last week, the Toronto Youth Cabinet, the students in my own riding at Bloor Collegiate Institute, and post-secondary students from all across this province. They all share many of the same concerns. They're watching and they're hearing from their families, from their friends. They know the toll this pandemic has taken, and they're worried not just about tomorrow, but about next year and the year after that. They're worried about their future. I wish they didn't need to be. But this is a generation that has always been able to look beyond the present. You know, they live in real fear of the ravages that they or their children will have to deal with because of climate change. And they're not willing to sit back and wait for adults, all of us, to catch up and take their concerns seriously. They're making change happen. And that's why this motion matters, Mr. Speaker, because by establishing a process that can engage young people in all their diversity, while valuing real collaboration from experts, frontline workers, and more, we can forge a plan that makes their future brighter. But let's face it, the pandemic has, without doubt, disrupted the life, the learning, and the well-being of Ontario's children, youth, and young adults. The toll is well documented already, particularly in terms of their mental health and well-being. We see it even in our own families, I'm sure all of us here. In their recent report, Children's Mental Health Ontario cited social isolation, removal from school and daily routines, as well as isolation and loss associated with illness as some of the top stressors that children are facing. Constant changes in school routines and classmates is coupled with the new fear of bringing the virus home. Just think about the impact this has had on youth with pre-existing mental health issues, or complex support needs, or undiagnosed mental health concerns. It puts them in an even more precarious position than before the pandemic. And we know that if you are a child or youth who has been directly affected by COVID-19, whether it's through illness or loss, or if you're in a low-income or a racialized community, you're even more vulnerable. In fact, we've seen the research from Sick Kids this February indicating that 70% of youth experience a deterioration in mental health. We've seen a sharp rise in eating disorders, outpatient treatment increasing by 200%, referrals up 90%, young women, LGBTQ2+ youth reaching out to mental health lines at surging rates. I speak a lot in this place about the need for our children and staff to have safe schools. Why? Because we know that the priority has always been and will always remain trying to keep our schools open for in-person learning, but it has to happen safely. The impact of the shift to online learning, the constant transitions, are having negative impacts that we're only just beginning to understand. And that's in spite of the heroic efforts of our teachers, our EAs, other education workers who've really gone above and beyond. Studies are showing that the lack of access to in-person schooling, outdoor activities, and friends during the pandemic has also meant worsening sleep patterns and diets, less physical activity, and more screen time. Let's be clear, this is around the world. It's not just here. We know that. Younger adults, students especially, we're starting to see the impact, particularly on younger students, at reading levels. And a recent study by the Vanier Institute on the potential impact of the pandemic on youth education in Canada concludes we are looking at an increase in the socioeconomic skill gap by as much as 30%. 30%. How do we even begin to make that up? Let's not forget that many low-income students are primary providers for their families, both students in high school and, of course, working post-secondary students. Speaker, and this really breaks my heart, 45% of youth say the pandemic has negatively impacted their optimism for the future as they see growing unemployment and feel their education isn't adequately preparing them for their desired careers. Speaker, Ontario's children, youth, and young adults are not asking us to wait and see. They are demanding action. We need a whole-of-government approach as we seek to recover from COVID-19, and we need to acknowledge that young people are the engines behind our future economy, one that has to be fueled by a creative, healthy, resilient workforce, and that their well-being is absolutely essential to our social progress. We have to address the inequitable impact of the pandemic with intention. We can't look the other way. It's not debatable whether Black and Indigenous children and youth from low-income families, youth in care, young women and girls, queer, racialized, and youth with disabilities have all had to bear a disproportionate amount of risk and hardship due to this pandemic. The data is there, as are the systemic barriers they already faced going into this. They cannot be left behind. They have to be prioritized, and their voices need to be central to the development of our recovery plans. This won't be a plan that's rolling out over weeks or over months. We need to be prepared to center young people in this work for years to come, and that's why I've proposed this approach. I've received some good counsel, I have to say, from lots of people, but one of them, and he provided a fair amount of guidance too, was the former Ontario Child and Youth Advocate, Erwin Ellman, and he sent me a note that I want to read a part of. He said, "In the challenge and wake of the pandemic is found the opportunity to ensure that every act we will take together in order to improve the well-being of Ontario's children. Our children are watching." To all my colleagues here today, I know that we all share the resolve to support Ontario's young people. I hear it every day. Let's take a step in the right direction. We can work out the details. We might even disagree, I think we probably will, on some of the steps that need to be taken. But one thing is absolutely certain. We must ensure that every child doesn't simply return to, life as normal, because life for too many simply wasn't good enough. We must provide them with more opportunity, with more support to reach their full potential. We need to put in place the mental health supports, but we also need to address, in a really systemic way, those losses in learning, the impact of this disruption on their job opportunities and training opportunities. And that's why in this bill, I didn't just include children and youth, I included young adults as well, those young people who were stepping out for the first time. They're really essential to our future. We cannot afford to leave them behind as we move forward in recovery. We need to provide them with the more opportunities and more supports to reach their full potential. Establishing a child and youth post-pandemic recovery secretariat tasked with developing, with monitoring, with creating an action plan says something important to those young people, whether they're 4 years old or 21 years old. It says, we see you, we hear you, we know what you've been experiencing. We're willing to put you at the center of everything we do. Let's do them that honor, Mr. Speaker. Thank you.
Thank you. Further debate. I recognize the member for Ottawa West Nepean.
Thank you, Speaker. And I'm pleased to rise today to debate Motion 145, introduced by the member for Davenport. I want to thank the member opposite for bringing forward this motion. I know that she has a passion for supporting our children and youth, and I appreciate that she brings that to debate here in this chamber. Over the last year, COVID-19 has had an unprecedented impact on all of our communities. Our government moved quickly at the onset of this terrible pandemic, and we have worked tirelessly since day one to protect all Ontarians, but especially those who are our most vulnerable. Vulnerable children, such as those with developmental disabilities or those who live in food-insecure households,